Anesthesia during plastic surgery procedures is a really helpful tool, and it actually will keep you safer than not having anesthesia at all. Let me explain. Anesthesia with a licensed anesthesiologist or CRNA is a very safe procedure. Sometimes they can simply do it with an IV drip, like if you were having a colonoscopy. Light IV sedation where you're breathing for yourself, you're comfortable but you're asleep. This is a great option for some of the procedures we do. Sometimes we need something deeper, so we'll put in an oral airway that inflates, giving you oxygen but not necessarily gas. We give you several medications through the drip, you're a little deeper. We can do breast reductions that way. We can even do some of the tummy tucks. We can do any liposuction that way. It's a great option. But if we're doing flank liposuction or buttock fat grafting, we often want to turn you over. In that case, it's safer to have a tube. That's general anesthesia with intubation. That's okay too. It keeps you safe, okay? Because if you don't have control over the airway, it's actually more dangerous than giving anesthesia or sedatives without controlled airway. Because it's not safe if you have deep sleep and you don't have a safe airway, okay? That's dangerous. Let me put it to you another way. When you come in and have anesthesia in our surgery center, we bring anesthesiologists over from the St. David's system. We have several MD anesthesiologists, one's a cardiac fellowship anesthesiologist, and 3 are former heads of anesthesia for the entire group that staffs St. David's. Great people, a curated team of anesthesiologists and CRNAs. In their hands, you're safer going under anesthesia than you were driving to the office that day. The anesthesiologist is there to keep you safe, making sure your airway is safe, making sure you're comfortable, allowing you to be truly asleep while even breathing for yourself so that we can do the procedure with you comfortable. Before surgery, we will give you medication to prevent nausea. During surgery, we will give you medication also to prevent nausea. We keep the gas off or low as possible, giving you mostly oxygen, and using IV anesthesia, the lowest dose that keeps you comfortably asleep. Literally, patients wake up in the recovery room and their first question is, "Have we started yet?" And the nurse says, "You're already finished," right? It's a great way to have a cosmetic procedure safely with an anesthesiologist or a CRNA.